Kia ora, nau mai ki te whare. Welcome to The House, ko Louis Collins aho. One of the focuses of this coalition government is removing burdensome overregulation in the name of boosting productivity. This deregulation campaign has manifested in Parliament in the form of legislation which David Seymour, the inaugural office holder of Minister for Regulation, often describes as cutting red tape. This legislation transcends portfolios, with legislative changes being made to the regulation of the environment, agriculture, the economy, housing and infrastructure, and even hairdressing. Also in that list is access to and approval of medicines. The Medicines Amendment Bill intends to streamline the approvals process using the rule of two. Here's Minister in Charge, David Seymour, during the first reading, explaining what that means.
If a medicine has already been approved by two recognised overseas regulators, then MedSafe, the government's agency for consenting medicines to be allowed to be marketed in New Zealand, will not need to carry out its usual full assessment.
Those recognised overseas regulators include the EU, Australia, Canada, US, UK, Singapore and Switzerland. The bill also reduces some of the barriers to the prescription of medicines by allowing more healthcare professionals like dentists, nurse practitioners, midwives and optometrists to prescribe medicines within their scope of practice. This week, the Health Select Committee was taking oral submissions on the bill. Most of the organisations that presented to the committee were in favour of the bill's intent, but had suggestions on how it could be improved. One of those organisations was think tank the New Zealand Initiative, who were represented by economist Dr. Eric Crampton.
If we think about the reason that drugs are slow to come to the New Zealand market, in my view, is that we are a small, relatively poor country at the far end of the world that will not be at the top of anyone's agenda in getting their regulatory affairs team to deal with paperwork. First, you'll want to target the markets that are most lucrative because that's how you pay the bills. Then when your regulatory affairs teams are freed up, you move to the next market, to the next market, to the next market. It can take years after a drug has been approved by at least two markets overseas before anybody puts them into the New Zealand approvals process. This is a problem. Pharmac will drop drugs from their consideration list if they have not been approved. They've done this before. We documented in our submission where they had the large majority of drugs pulled from their consideration in one of their evaluations was for the stated reason that there is no known approved product or anybody trying to get it approved in New Zealand. Important drugs were delayed for years to 12 years. I haven't got a number on how many people died or were harmed as consequence, but the invisible graveyard is large, and nobody gets fired for delaying a drug.
The committee then heard from Graham Jarvis, CEO of Medicines New Zealand, an association representing pharmaceutical companies. He pointed out some of the issues with the bill, starting with what he called an own goal in its wording.
Words do matter in legislation, and there's a really critical word in the schedule attached to the legislation, which is working, as in working days. Now, ironically, you've just scored an own goal if you include that, because at the moment, 90% of all submissions by prescription medicines companies have a 90-day turnaround. That's 90 calendar days. If you introduce the term working days, that increases it by 40%. You're not slowing, you're slowing it down, you're not speeding up anyone's access to medicines.
Jarvis was asked by Labour's Aisha Verrill why his recommendations on approvals were more cautious than Crampton's.
Mr. Jarvis, you heard the preceding submission. Why doesn't your organisation favour automatic approvals?
Because that has unintended consequences around parallel importing and other activities. People flood the market and the product may not necessarily be what you think it is. You may end up with counterfeits products coming in. There is no clawback for the regulator to go after a sponsor who has been acting in an unsatisfactory manner.
That list of recognised overseas regulators I mentioned earlier is made up of jurisdictions that New Zealand often borrows or takes inspiration from in our legislation. Students from Victoria University's Wellington Community Justice Project suggested to the Health Select Committee that these overseas regulators, while historically reliable, may not be in the future.
Well, the bill allows the Minister to make rules for verification through secondary legislation so they can be refined to reflect changes in best international practice. We feel as though there needs to be something within the text of the bill itself, ensuring that the regulatory authorities themselves are regularly assessed and their standards upheld to the standards of best international practice. Our written submission mentions in particular the American Food and Drug Administration, which is listed as a recognised regulatory authority by the bill. The submission details our concerns with the FDA's placement on this list, most notably for the reason that the FDA is currently headed by RFK Jr., a health secretary who has been described as a conspiracy theorist, and relevant to this bill has cancelled or frozen billions of dollars of research grants for the development of medicines. Clearly, this bill will outlast RFK Jr.'s appointment. However, this example illustrates the need for a process to review the regulatory authorities in Section 22A, so when questions arise about a jurisdiction's suitability to be on the two-step verification process, these are able to be addressed.
The Medicines Amendment Bill will continue to be considered by the Health Committee, who are due to report back to the House by the 9th of August. I te whakaronga koe ki te whare. You've been listening to The House, a program made with funding from Parliament's Office of the Clerk. Mā te wā.